So do you look in the mirror sometimes and think, is that really me? When did I start to look old? Many of us feel
It's okay.
so much younger than we look, but there is a solution.
You betcha. Through a treatment process called Image Lift, you can knock years off of your appearance in just 90 minutes. We're joined today by board-certified facial plastic surgeon Dr. Richard Castellano with more info about this rejuvenating process. And you are a double certified plastic surgeon. Well, what does that mean exactly?
So I carry a board certification in facial plastic surgery and in head and neck surgery. And my most important credential is that I've done over 2,500 of these lifting procedures, and that's more than most do in 3 careers. So
it's a lot of lifting.
That's a lot of lifting. That's my focus. I don't do little body, little breast, little tummy tuck in, face on the side. That's all I focus on.
Just the face.
That's it.
So explain for our viewers then what this procedure is like and how you can do it in just 90 minutes.
Right. So most patients come into the office and say, I don't want a traditional facelift. I don't want general anesthesia. What can I do? So with the Image Lift, you can do a procedure where you take a little relaxing medicine by mouth. We do numbing medicine like at the dentist's office.
Can you come in and just take the medicine?
Joe would like to know if you have nitrous. No, just kidding.
Right.
Not at our office. Sorry. So, and after we do the numbing medicine, then we do the procedure. It takes about 90 minutes to do the Image Lift, and most patients say we're easier than the dentist's office.
Wow.
Really?
So this is an outpatient procedure.
It's
basically
all done in the office, and when you're done, there's no general anesthesia, there's no IV sedation. When you're done, you can walk to your car, you go home. We see patients 1 day, 1 week, 1 month afterwards, as many times as they need to be seen, but you don't need extended recovery time.
So with a lot of with some procedures, I know you have to come back and keep getting things touched up and so forth, but in general, is this just sort of a one-time procedure?
Well, with lifting procedures, keep in mind there's no one size fits all.
Right.
Okay, when patients come to our office, we can do mini facelifts, we can do traditional facelifts if patients want that. So depending on what they have done, I think patients may wait 5 to 15 years before they say, maybe I'll do a little bit more tightening, but it's variable. And the only way to really know is to have a consultation to figure out what is your customized treatment plan and what are your expectations, because some patients have different expectations. Some patients just want a little, some want everything, and the more they do, it's going to last longer.
You brought some pictures.
We want you to take a look at these because this is really amazing, and this is all through the Image Lift process, right?
Yes.
Obviously, the before is on the left, and boy, now this
You
is
don't even have to say. I mean, this is pretty obvious.
But
here.
I mean, these people are so confident in their appearance now, they're willing to show the before and afters on television.
Yeah, we ask all of our patients if they are willing to share their pictures, and most of them say yes. They're proud. Some even come up in the beginning and say, hey, can we be on TV? And so we did a medium Image Lift for Melba, and she's very pleased with the results.
This is a lady from the first photograph.
Correct,
Okay.
same woman, great improvement in her profile, and we did a little bit of volume under the eyes, little fillers. We lose volume as we age, so we gave her some fillers as well, and did a little eyelid treatment, and she's very pleased. She looks very natural.
Well, even her nose looks a little bit
It
more
really
taut.
does.
Now, her nose, I will tell you, there's just a little shadow difference there, but the main focus really is the neckline, where that's where you can see the difference, even though there's a little shadow. We didn't touch her nose.
Yeah. Oh, you didn't. But it does. Doesn't it look a little bit tighter though?
It does. It all looks like she's just been tightened up just overall. And I want to go back to this anesthesia thing for just a second, because everybody I've talked with who is afraid to do a cosmetic procedure, that is the reason. They just, you know, if you haven't undergone surgery before, people are like, I don't know what anesthesia will do to me. I'm not going to risk a cosmetic procedure to find out. But this is the answer to that problem.
Well, overall, anesthesia can be done very safely, yet there is a risk in everything we do. There's a risk when we get into a car and drive across town. So if patients can avoid the risk of that, if they can avoid the expense, if they can avoid the recovery, that's what patients really want today.
There's a gentleman that had a procedure done with some pretty dramatic results. You know, a lot of
Hey,
this.
wow. I think a lot of people think that women are the only ones who are interested in cosmetic procedures. Obviously, that's not the case.
Right. Men do a lot of these procedures as well, look very natural. This gentleman's very active, and people just want to look on the outside as young as they feel on the inside. So,
You know, from the side,
And he's
he was
even
doing-
more smiley now.
He was. Oh, here we go. Boy, now this looks like 2 different women.
yeah, she had her upper eyelids done and the Image Lift procedure, and she's very pleased with her result and looks very natural. Our goal is to get people improvement, keep them looking natural, and keep them safe.
Well, and talk about how, when you improve the outside appearance, talk about that has some internal effects too.
Absolutely.
I mean, very positive internal
I ask
effects.
patients all the time, do we live in a visual society? Yes or no?
Yeah.
Does age or appearance make a difference in our workplace or in our relationships? And we get judged by our appearance. Whether it's fair or not, that's just the way the world is. So we can help people with that. And if someone looks unnatural or overdone, as tight as the Hollywood celebrities, where some say if I sit down and cross my legs, my mouth is going to pop open. Patients don't want that.
No.
They want natural. They want to
Yes.
look like themselves and look more youthful.